Hey everyone, welcome to another week of Dentistry Unmasked. I'm Pam Maragliano-Muniz, Chief Editor for Dental Economics Magazine, and with me, as always,
Hey, Pam, David Rice, Chief Editor at Dentistry IQ. How are you?
oh my gosh, amazing. I had to wear my
Yay.
sparkles today because, regardless of where you stand on any topic, I think it's interesting and exciting and encouraging to see progress happen. And we're going to talk about a few different topics today, but one in particular, gosh, David, we've been talking about the staffing shortage, dental hygiene shortage, all of these things for 5 frickin' years now. And what have we been doing? I mean, we've been trying to up our culture. We've been paying more. We've been trying to do all of these things to attract the hygienists that are out there. Yet it seems like brighter days are ahead. And I am so excited today for this week's guest. I've got Dr. Abe Abdul. He is the president of the Mass Dental Society, and we're going to talk about all the things. But number one, if you want to pass a bill, you're in it for a long time, right? Like normally, like you're going to pass a bill, you're going to like put it in, and then like sometimes you never even hear about it again. And I think in some ways, these challenges that the people that participate in organized dentistry have is that they have all of these intentions. They try to do these things, yet we as like the end user, the practicing dentist might not see all of the progress that takes place. And so what that's done is I think it's caused maybe some mistrust in organized dentistry. People wonder if they should maintain their memberships. Gosh, we were at SmileCon last year and we were talking with many people about whether or not maintaining your ADA membership is worth it as a practicing dentist. And Abe has been able to put through two bills, not just like one, and I'll see what happens someday when I'm not president anymore. He's had two bills passed. So we're going to talk about the bills themselves, what's happening in Massachusetts, maybe how other states can be empowered to actually see change happen, and also freaking Abe, how did you do it? It's amazing and welcome.
Thank you so much for having me today. I really appreciate it. It's always energizing listening to you speak. I've known you for a long time, and thank you for having me here. So let me start with saying, be a part of organized dentistry. Be a part of be a part of the ADA, be a part of the AGD, be a part of the Alliance of Independent Dentists, be a part of something. All right, dentistry can get very, very lonely, and the only way we can succeed is, if we speak with a unified voice. And being a dentist is hard. It's hard work. You're managing the business part of it. You're being the doctor. You're being the caregiver, and in some cases you are being a policy advocate. In some cases you're being a member, a leader in organized dentistry. Being a dentist has been very, very hard. It's been very tiring. And as you have mentioned, we've known about this shortage in staff for many years now. In 2022, the ADA HPI Health Policy Institute put out information, scary information, that 30% of dental assistants and hygienists plan on retiring, and this is in 2022, in the next 5 years. 30%. Isn't that scary? And with COVID, a lot of hygienists didn't come back to work. Childcare was a huge issue. Burnout has been a huge issue. Why does burnout happen? People are overworked. And as Pam, you mentioned, we've tried everything, increasing wages, improving benefits, but yet there's still a shortage of assistants. Workforce shortage has remained one of the top issues, top concerns of dentists across the nation. In Massachusetts, as you both know, we've been very, very progressive. We are the MLR state. Thanks to the work, of Dr. Morris Gala and myself, we both worked on MLR, and we brought MLR to Massachusetts. We're not talkers, we're doers. We brought MLR to Massachusetts, and now it's spread. It's spread across the nation. Many more MLR, DLR bills have been brought up. But today we want to talk about workforce shortage. And we're very, very proud that we were able to bring this foreign trained dentist bill to Massachusetts, and we just passed it last week.
I
I
know
love
I,
that. Oops,
oh, go
sorry,
ahead.
Pam.
No, no, no. Go, go, go.
I love it because it's a solution as opposed to Pam, what you were alluding to earlier, like all the chatter that's gone on for 5 years. Okay, we're moving in the right direction. So how do you handle those out there who feel like, well, are these dentists as qualified to do the job? Like that's a buzz. So what? How do we respond to that?
You know, that's important. You know, we as doctors, you know, we took an oath, and the oath is to protect our patients. Just remember that, you know, every decision we make, everything we do, has to involve protecting our patients. So let's talk about the shortage. The shortage, hygienists are so important. They're so critical. Some people call them gatekeepers. I would call them gate welcomers. Okay, they're there to welcome our patients. And when you don't have a robust hygiene team, when you don't have hygienists, you are restricting access to care. You are hurting the community. You are hurting the population. And you know who you're hurting most? You're hurting the indigent communities the most, the Medicaid population the most. They're the ones who get hurt first. So to protect patients, we need to improve and maintain access to care. So let's talk about foreign trained dentists, right? Did you know, and I know you both know this, they already practice in our FQHCs. You folks know this. They teach in our dental schools. You know, there can't be this two standards. One where we're like, you know, these guys are dangerous. On the other hand, we let them treat the most vulnerable in FQHCs, and we let them teach our dental students. Look, this stigma, and I'm going to say it, this stigma against immigrants, this stigma against foreign trained dentists, let's cut it out. This needs to end. Okay. Let's talk about the bill. You know, what sort of safeguards do we have? There must always be a safeguard. You know, our graduates that graduate from dental school, they need to take tests and they need to take exams, right? To make sure that they're competent. We don't just let them loose once they graduate from dental school. When we developed this bill, we took into account safety, okay? And we wanted to make sure that these foreign trained dentists have graduated from a qualified dental school. They practice for at least 5 years in their home country, okay? And they have been scrutinized by the Board of Registry and Dentistry as to their qualifications. You know, we pushed very hard for this. We told the story of access to care, and we knew we had it with the House, the Senate, and with the governor. We knew we had it. And when we were about to pass this bill, the Hygiene Association contacted us and said we had concerns. And you know what would any reasonable team player do? Listen. It's one of the things that, you know, a good doctor would do. We listen. We listened to the Hygiene Association. They wanted an examination component to this foreign trained dentist bill. And I overwhelmingly agreed and said, yes, that is what we should do. So the safeguards are here. We believe that, you know, the system is robust. We know that foreign trained dentists practice in our FQHCs and teach in our dental schools. So it is my opinion and that of now our hygiene colleagues here in Massachusetts that this is a safe and effective bill that will improve and protect access to care for everybody, and especially the vulnerable.
I think it's so
Awesome.
interesting. Now, this doesn't just pertain to foreign trained dentists. This also pertains to dental students, correct?
Yes, it does. So the law states that dental students who've had 4 full semesters of dental school may be eligible to get a hygiene license as well. I mean, Pamela, do you remember when you were in dental school? Many of us struggled, you know, financially, right? And you know, at my last meeting with the deans, they told me something about food insecurity. Have you guys heard about this food insecurity? You know what that means?
But
I
share what it means to maybe some
I,
people who don't.
I didn't know what it meant when they said food insecurity. I thought I knew what it meant, and I hoped it wasn't what I thought it meant, but it's exactly what it meant. That some students are struggling to afford food as dental students. That is embarrassing. In the richest country in the world, they're struggling to afford food. And Pam, you remember in dental school, a lot of our classmates, worked in the libraries, worked in the cafeteria. My best friend Stas, he worked as a security guard at night. A security, you know why he liked the security guard job? Because he got to study, right? Look, are we better off having our third-year dental students be security guards, drive Ubers, flip burgers, work in the library? Or are we better off allowing them to get a hygiene position? I've never seen any research study out there that says clinical exposure harms a dental student or harms anybody. If anything, Pam, I cleaned my patients' teeth for a decade, right? And because I couldn't afford a hygienist. And it helped me improve my rapport with my patients, improve my ability to examine my patients, gained trust with my patients, So for those students and for the naysayers out there that are against dental students getting a hygiene license, well, good for them. They have the resources to cruise through dental school and not worry about their finances. And, they may not be able to take a job. But for those of us who are the security guards, the Uber drivers, the burger flippers, it creates practical change. The era of talking and not acting, the era of just discussing and researching, it needs to come to an end, because practicing dentistry is very, very tough. We need pragmatic changes. We need to think outside of the box. We need to break down these barriers, these stigmas out there. Otherwise, dentistry is not going to survive as a profession.
So I had an uncle who used to sit down with me when I first started in dentistry, and he's like, so you practice dentistry, like when do you actually get good at it? Ha ha ha. But to this conversation, I know we worry about young dentists going out there with, little experience from dental school. I certainly think going out there on the hygiene side is way less invasive than going out there on I have a high-speed handpiece in my hand and can do sort of irreparable harm. I love this. So, and you mentioned like guide rails and safeguards. What does it take for a dental student or a foreign trained dentist to be able to flip that switch and do hygiene? Like, what do they need to show in addition to like time?
Well, they've got to, I'm reading the law that as written, they need to show a certificate of registration that from their home country. They need to prove that they graduated from a dental school. They need to be examined to prove that they're at least at the level, if not better, than what standards we have here in Massachusetts that exists. The border registry, and please don't call the border registry. They've been getting a lot of calls, and don't call your legislators, because there's been this overwhelming interest in getting this hygiene license. They are still working on what the exact rules, regulations are. So we created a law, we created the statute, the board, the DPH, they will then create the regulations. And as soon as these regulations are created, we will have specifics. But overarchingly, they need to have 5 years experience. They need to have a certificate of registration. They need to prove that they've got this information. They need to prove and they need to be examined and prove that they have the skills that makes them competent and safe to practice. And as far as dental students are concerned, they need to be a part of an accredited program, and they must have had 4 semesters. 4 semesters. So essentially, they've got to finish their second year, right? You guys all remember this. We started seeing patients our 3rd year, right? We started doing some simple fillings. We started doing hygiene. We're already doing it, and in med school, they start doing rotations, medical rotations. They do rounds, right? So let's give those who want this opportunity the opportunity. Let's not be in the camp of robbing opportunities from others. We shouldn't be doing that. That's not innovative. That's not creative.
Will the students additionally have to pass this exam?
When I read the law as is, It mentions the four semesters. As far as the exam criteria, examination, I think this is still up to the board. The board laws are interesting. You know, when you create a law, you create a statute like MLR, right? What happens is the Commission of Insurance comes in and then they determine the specifics. They listen to, you know, the input from everybody and then they determine the specifics. This law has yet to determine some of those regulations.
Yeah. I could see where that's going to be important for a dental student to show some competency, just like you would ask a foreign trained dentist to do. I think that would be fair.
There are risks always when you innovate and when you create and when you try something new. The important is to listen to the reasonable voices that are around you, voices that are not here to stifle innovation, but voices that are here to improve. And you know what? Once this law is implemented and the regulations are implemented, we may reach a point where some modifications may be necessary. And we need to be open to that. We need to be accepting of that. It's very hard to balance between innovation and challenges because you don't anticipate complications down the road. You try. Whenever we do a procedure, when you place an implant, when you do ortho, when you do endo, there are some unanticipated consequences down the road, right? But as doctors, what do? We care for our patients. We study what the complications are, and we try to innovate and try to find a solution. Creating laws and creating new policies are just the same. We don't have all the answers, but it's important that we work together to find those answers.
I think it's really interesting. And I feel like, I mean, I know there's like a teacher in my DNA, and I feel like mentorship is in my DNA. And all of the dental students I've met with, which is a drop in the bucket compared to what you work with, David, they want mentorship. They want a relationship with dentists in the community. And I really feel like, regardless, even if you hired whether it's a new grad hygienist or a hygienist that's been in the been working for 15 years, every practice is going to require some semblance of onboarding and training and everything else. So I feel like if you find the right person who jives with your team, I feel like there's not much of a downside to it. Now, I have another question for you, and this may or may not even be possible to know, but how many foreign trained dentists are just like chilling in Massachusetts without a job or without a dental related job?
I like your description of chilling.
Oh, because what? I mean, they can't practice, so what are they doing?
Right. So I'm an immigrant. Most of my patients are immigrants. Most of my office staff are immigrants. Um, a lot of us, we come to this country because we want a better life. And a lot of us, we come from a country that's not as well off as the United States, not, without these same opportunities that we have here in the United States. Immigrants are far from chilling. And I know you said it jokingly, but, there are Uber drivers. They're working at TSA. They're working at our burger joints. They're working at our restaurants, some of them working hard labor, our landscapers, I met a dentist from Brazil who was a security guard and a landscaper because he doesn't have a license to practice here. We bring all these people to this country, and then we don't. In a lot of ways, we create opportunities for them, and this is one of the ways we're creating opportunities. But we need to create more opportunities, right? So these doctors, they come to this country, and they're struggling. A lot of them are struggling. You and I are struggling because we don't have staff. The ADA talks about the struggles. There's a disconnect. Do you see the disconnect right off the bat? There's a disconnect. And then what's creating this disconnect is fear. Okay, let's accept the reality. The fears that these people are going to come take our jobs, the fear that these people, these immigrants, are not qualified, the fear that language and cultural barriers could create problems. Some of these fears are pure fabrications. There's no basis to them. And what we're trying to do, like I said, is make it safe, find a pragmatic solution for this to happen. So these immigrants, you know, they can live a better life. They can be our future dentists, right? You know, some of them can go through hygiene school and they can feed their families, right? And when they make a reasonable income, that can be utilized for them to go to dental school in the future, if they choose to do so, or maybe med school or whatever pathway they want to be. And you know, not to be to speak on behalf of government, that also translates to taxable income, right? And for you and me, Pam, you know, it translates to getting a hygienist, right? And for the Hygiene Association, guess what I've heard from Massachusetts? They're anticipating an increase in membership from all these new foreign trained dentists becoming hygienists. They're anticipating an increase in membership. And you know, for the hygienists who are burnt out, why are they burnt out? Because they're overworked. The dentists are like, look, I'm going to pay you more. Can you work another few hours? Can you see 3 patients in an hour? 2 patients? That's burnout. That's creating burnout. And I also don't foresee a lower of quality, a lowering of quality of lives for our existing hygienists. Absolutely not. The crisis is so severe, so critical, and HPI has shown this. We have no way, you know, short of this methodology, we have no way of figuring out another way to inject so many hygienists into the system. Now, as to your question, how many of these hygienists are chilling? These foreign trained dentists are chilling, okay? Let me answer that. In Massachusetts alone, just the 3 dental schools, there are 5,000 applicants for international programs, meaning 5,000 foreign trained dentists are applying for 200-ish spots in Boston. So 4,800 of them don't get in. Now, these are only people who apply. People who failed their TOEFLs, people who absolutely don't have the financial ability, people who recently had a family, people whose English is still, you know, a little bit wobbly, okay? Those folks are not even applying. So we don't know. But, you know, the higher, as let's say of the 5,000, let's say 10% would take on this hygiene path. It's 500 hygienists. What would 500 hygienists do? A lot in Massachusetts.
That's extremely impactful. And I think that,
Yeah.
you know, obviously there's people who feel a certain way about it. There's some people that are super excited about it, but I do think you're right. I mean, you really can't argue with, at the end of the day, what's important. It's patients. And it's become so clear, the connection between oral health and systemic health. And we have a responsibility to do our parts to get people healthy and, you know, do what we can do. And unfortunately, sometimes we can't do that because of, you know, what's been happening. So, I mean, I applaud you for this because I mean, it really truly is so impactful. And I don't want to not spend time on the next bill because the next bill is also really impactful. Would you share the story about the Dental Diversion Bill?
Pam, you know, you mentioned how important it is, how important health is. And you know, sometimes we forget something. David and Pam, we forget this. Our health is important. Really, Dave and Pam, our health is so important. You know, my personal, you know, being ill and having family members that have, you know, experienced some traumatic illnesses makes you a better doctor because you understand what it's like to be on the other side. This next bill reflects this perception for a long time that, well, the lack of this bill, that we doctors, we dentists are invincible. We don't get sick. We don't have any mental health issues. And if we do, we should suck it up. And if we make mistakes because we have mental health issues, or if we have addiction issues, well, too bad, we should be punished. And our license should be taken away. That is simply unfair. That is simply unhealthy. And that's not protecting public health at all. Because, it takes hundreds and hundreds of thousands of dollars to create a dentist, to build a dentist, hundreds of thousands of dollars. It creates a village to build a dentist. The family that's involved to support you to undergrad through dental school, your community that supports you through undergrad through dental school, your community, if you're an immigrant again, right? That's looking forward to you coming back to that community to serve them. I speak Chinese, and I lived in Quincy. My community was looking forward to me coming back to Quincy to start a practice to provide them with care. Cultural competency, language competency, these are critical in terms of providing effective care. And care is always better when it's delivered locally. Okay? That's the reality. These are things we know. 5143, which was originally Bill H300, these are just numbers that don't make any sense to anybody. This gentleman, I have to tell you the story since you guys got me started. So I'm going to tell you the story. About 8 years ago, this gentleman, Dr. Alan Budd, came to me and said, Abe, you're into advocacy. We need you to protect the dentist, and we need a dental diversion bill. This was 8 years ago. And I didn't know much about it. Al educated me about it. Al had personal experiences in helping a lot of dentists with addiction and mental health issues, dealing with the board or registry when they were found to be at fault because of the addiction and the mental health. For 8 years, we struggled. We struggled really hard to get the legislators to listen, to get our own community activated to care enough to do something. That's a problem. Sometimes we, the profession, we neglect certain things. Fortunately, this last year, we activated our community, and we had a great state representative, Representative Taki Chan. He was willing to co-author a bill with me, H300, where we create a diversion program. What does that mean? It means the board doesn't have an option, but the board shall. These key languages, key words are so important. The board shall utilize a diversion program. So if a dentist is found to suffer from mental illness or an addiction issue, he can voluntarily inform DPH of such issues, and he could be put into a rehabilitation program. And if he successfully completes the rehabilitation program, the board will negate, close the complaints against him or her. And these files will be kept for 3 years, but they're not publicly available, so it cannot be subpoenaed, okay? And after 3 years, the file is destroyed. The dentist gets his life back. He goes through rehabilitation. The community doesn't lose a dentist. It's a win, 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 win for everybody. That's what the bill does. And I'm eternally grateful to Representative Chan for allowing me to author this bill. I'm eternally grateful for advocates like Alan Budd, Dr. Budd, for coming and bringing this to light. And as president of the Massachusetts Dental Society, this was the first guest that I brought to my first board meeting. Because Alan has been trying to get in for years and years and years. As president, that's the first person I brought in. Do you know what? Because we as healthcare providers, if we don't take care of our own, how are we going to take care of others? We're not invincible. We're mortal. We're human beings. We have stresses. And this bill, I hope this bill invigorates more states and more in the profession to think about ways to help members of our community. And I have to give kudos to our health and wellness committee at the Massachusetts Dental Society, run by Dr. Lowenstein and Dr. Budd. They've done such a great job trying to find different ways to reduce stress and improve health within our community. And we are far from completing our job. We have so much more to do.
That's, first of all, this is absolutely incredible to me. I have been a part of many dental societies. You know, I lived in New York, so I was a part of that. I'm now live in Florida. I am a part. Florida also, like, just shout out to you, Florida. You're crushing it. But I've been brought into many dental societies that just seem to, you know, with all the best intentions, struggle to make real change. So as somebody who has been extraordinarily impactful in making change, like, what advice would you give to those dental societies who, you know, they want to do all the same amazing things that you're doing, but they're just maybe not, they're not quite there. They need a little something, like a secret ingredient. What would you share with them?
It's a secret. I can't tell you, David.
It'll cost them.
David and Pam, you know, Pam is, you know, you followed me through the MLR journey, you know. You know, you were there and you listened to me when I first talked about MLR, when it wasn't headline news, when it wasn't the sexy topic. You know what I'm saying? It wasn't David versus Goliath. It was the little P against Goliath, right? You know, when we started that journey, we were ridiculed. Nobody believed in us. There were some in organized dentistry that came after us. It wasn't the insurance companies. It was some of our own that came after us and punished us, punished me for doing MLR. Why? You know, Alan Budd, I tell you, the hero of the story, you know, I mentioned, you know, he approached me 8 years ago. He's been doing this for over a decade. Why wasn't he given the time of the day by organized dentistry? Right? I know you're asking me for the secret sauce, but I need to ask some questions, right?
Sure.
You know, we talk about health. I'm a human being too. I have a family. You know, my mom is disabled. I care for my mom. I run my practice. I'm a human being too. And the rocks that were thrown at me when I did MLR, those rocks really hurt me. Like they really hurt me. They affected my mental health, right? You know, Alan, why is it that he had to wait 8 years to be heard? Why did he have to wait 8 years? He's putting his flesh and blood, his life, to help dentists, you know, protect them and protect his community, not just the dentist. You lose a dentist, you're losing access to care. Dentist equals access to care. All right, just don't forget that. Hygienist equals access to care. Don't forget that. When you take the dentist out of the picture, you lose access to care. Why? The workforce shortage, right? The HPI data has told you in 2022 that the shortage is going to get worse. It even states this. They do not foresee that the dental assisting shortages to improve. It's in the HPI report. But yet, have we as a profession, have we done enough to resolve these matters? You know, the secret sauce is this. The secret sauce is we all need to take a step back. In dentistry, we all hold, many of us, we hold our positions and we anchor. You know, we anchor. Anti-MLR, for MLR, against foreign trained dentists, for foreign trained dentists, right? We anchor. It's time we take these anchors away and we start to listen to some of the newer ideas. Some of them may seem crazy, right? Like MLR, you know, it was a crazy idea, and you know, some people threw rocks at us, right? Like the Dental Diversion Bill, or your hygiene bill. It could never be done, right? Take away these anchors. Listen to your opponents. Listen to your proponents, and sometimes innovate. Nothing is impossible. Really, nothing is. If you're willing to put your heart to it, you can get it done. And finally, I authored these bills, but I can't take credit for this work because I have an army. I had an army for MLR. I had an army for the Dental Diversion Bill. I had an army for the Hygiene Bill. These folks that supported, the support comes in attending political events. You must attend, okay? You must do your part. My army attends events. My army holds events. My army calls the legislature, and they call and call. The Hispanic Dental Association of Massachusetts, they have made countless calls to the state legislature supporting the hygiene bill. My army, part of the Mass Dental Society, Dan DiTullio, and my lobbyist, Roger Donahue, they've done such an incredible job in the background. A lot of things happen in the background. They've worked the background. My army, Dr. Mo Riscala, he is a servant of the profession. Without them, there are no bills. There's no hope. There's no innovation. Build your army, and and some of the people in the army may be people who don't agree with you. I've got many in my army that calls me and goes, "Look, I like this, but I don't agree with you." And I'm like, "That's okay. How about we work on the things we agree upon?" Our hygiene association does not agree with certain policies that I am supportive of. But when it comes to policies where we agree upon, we have worked together, like the foreign trained hygiene bill, foreign trained dentist hygiene bill. So build your army, innovate, listen, and create practical change. The days of just talking, empty talk, is over. If organized dentistry is going to survive, it must act and it must deliver. If it chooses to continue to just talk, okay, who's president, who's a trustee, all those things don't matter. Pam, Dave, as wet finger dentists, who's president? What does that do for you and me? It does nothing. What I care about is legislation that allows me to operate my practice safely, my overhead, my staff, having staff. I mean, look, what are we asking for? We're asking for staff, right? Talking about it, what does that do for us? It doesn't do anything.
Yeah, agree.
Totally agree. And gosh, there's something so I feel like there's all these undertones that I'm loving so much about this podcast. I feel like it's about raising people up around you. It's almost like just, any initial fear that you might have, well, then just take a second. And Dave, you say it all the time, slow down to speed up. Like, just take a second and hear what this is about. And if it's not for you, don't hire them. Like it's really easy,
Yeah.
But for many people in our community, and I mean, so many friends of mine, I can't tell you how many times I sit down to hang out with my friends in Massachusetts and the conversation inevitably goes to the dental team and the lack thereof and the things that we're trying to do to keep them. And some of the things that we are doing is just absurd because we're just, kind of trying to tread water here. And so if it's not for you, fine, no big deal. But if it's not for you, sit back and learn why. And I just, I don't know. I feel like after listening to you, I just don't see a downside to any of these things. I also see on so many social forums, dentists smacking around other dentists for something stupid, whether it's their photography or some, a composite that they're posting. But you're thinking about what you're doing with the dental diversion bill, and it's going to save lives. It's not even about just keeping a dental license. I mean, that's part of it and that's important, but it's about saving lives. Think about how many dentists we see, whether you know them or not, on social that are taking their own lives, that are losing their lives because of the shame or not able to get the care that they need. So this has just been such a, I don't know, like I don't know. I'm so happy and so grateful to you for a few reasons, for you giving us your time today. But I'm so proud that you're my president in Massachusetts because you're getting shit done. And we don't see that all the time. And I couldn't be more proud to have you as our president and to be representing all of the communities that you do. And you do it just so positively. And I just can't thank you enough.
Love
Thank
it.
you. Thank you. David, thank you. I'll tell you about the dental diversion bill. We don't know how many of our colleagues are suffering. And because laws like this were not in place, we really don't know. I hope this law will create the opportunity for those who are suffering to come out, to get help. And I want to say that the Massachusetts Dental Society and I and Al, Dr. Bud, we stand by. If anybody needs to reach out, I want them to know that they can reach out to their Massachusetts Dental Society. They can call us. They can call me. And Pam, if you put my email out there and my number out there, I want to know that I want you and everybody to know we're here for you. We want to listen. And we will do everything we can to help you. And Dave, don't forget, you're a human being. And you just like me and everybody, we have limits. We need to learn to stop throwing rocks at our colleagues for creating good ideas like MLR. We need to work together. We need to protect our profession. We need to improve and protect access to care. And enough talking. Let's get things done. Thank you.
I love it. Friends, thanks for being here. I don't know where the time goes. I feel like we could do this for 10 more hours, but you have a choice. You can be a part of the problem. You can be a part of the solution, or you can just go out there and complain and do absolutely nothing. But get involved. Find great people. That's the start. I think that was a big theme today. Surround yourself with great people and get out of the box, and let's make some progress together. Pam?
Yeah, thank you everybody for joining us. Abe, thank you so much for sharing everything that you're doing. And again, for all of the work that you've done for us in Massachusetts. And everybody out there, thank you for joining us. And so I'll share a bunch of things for you in the some links in the show notes, even our video that we shot ages ago about MLR, because we've mentioned it a few times, but you might want to learn more. So I've got all the things for you. So check that out, and we will see you all next week. Be good.
Bye, guys.
Thank you, everyone, for watching or listening to the show this week. And thanks to our guests and sponsors on this episode.
Please check out our social media at Dr. Pamela_Maragliano and at Dental Economics Official.
Or you can check me out at Ignite DDS or at Dr. David Rice.
And go to dentaleconomics.com to receive dental economics. You can choose to receive DE in print or digitally, and you can also get the details of our Principles of Practice Management conference on our website.
If you have topics or guests or anything you'd like to talk about on the show, send us an email to dentistryunmaskedpodcast@gmail.com, and we will do our very best to make it happen. Thanks again, and we'll see you next week.